Huples cat. Just going to talk a bit about the video I just did on face masks and improvising equipment. I just thought, you know, I did put the trash bag on, a fresh trash bag, and showed how to do it and getting a tight seal, how to take it off. I think when I get some energy, what I'll do is I'll do a full run through of putting the stuff on and putting the stuff off, and the order of which you should remove and put on stuff. Because I think that's one of the things that confuses people. One of the things I recommend is that you actually do this in front of a full-length mirror in your hallway, or preferably an entry of your house before you enter the house. And you have the full-length mirror there, and you also have a list of instructions written out, so you know the order you're putting stuff on, and then you know the order you're taking it off. And of course, if you can have a second person helping you get the stuff on, that really helps. Though they shouldn't be in the room with you when you're taking the stuff off. So the most important thing to know about face masks and protective equipment, personal protective equipment, PPE, is that you shouldn't need it. If you are in an infectious zone, you shouldn't be going out. And if you've done quarantining early on efficiently, nobody in your household, including you, should actually have the influenza or whatever the bacterial agent is. In this case it's a virus. But that's wishful thinking. You may have to go out to get food. You may have to go out to go to work. Your kids may have to go out to go to school. All of those issues are worth thinking about what you personally do in your personal circumstances. All I'm saying here is that every member of the family should have access to proper medical grade personal protective equipment. And even if you do have that gold standard, have enough scarves and gloves and toques to put on your head for the hair, and maybe swim goggles or other types of goggles to actually protect yourself if it goes on for weeks to months and you run out of medical equipment. Going through garbage bags outside of hospitals trying to find used N95 masks is not something I will ever recommend. I can only imagine the absolute desperation of the people that have been forced to do that. I can only imagine it. And I don't want that for me or my family. So yeah, actually using a face mask is a failure. It means that you are having to go out in the community where the infection is, or you've already had the infection introduced into your home. But, you know, life's life. But anyway, information's important. This is more important probably than face masks. Real, truthful, hard facts that you can use that can protect you and your family and your local community. And one of the sources that I'm using, though frankly it's not great, is the Ontario Health Ministry's site for healthcare professionals. Now they are telling us strictly that it is just for healthcare professionals, though you don't log into it. So if anybody out there is a healthcare professional in Ontario and they want to look at the site, they'll be able to see the address bars and go to it. And I might even link it down below. But remember, it's only for those people who are healthcare professionals in Ontario. But one of the interesting things with it as we go through it is what they're actually recommending. Bearing in mind this is the 2nd of February. So the PUI is what we're calling this. A PUI is any person who has a fever and or onset of cough or difficulty breathing and any of the following. Travel to Hubei province, including Wuhan, China, in the 14 days prior to illness. Now, I'm not quite sure why we're not screening everybody who is actually travelling from China at this point, but we're still not. Close contact with a confirmed or probable case. Okay, that's rare, and that will actually get higher. Or close contact with an acute person with respiratory illness who's been to Hubei province, Wuhan, China 14 days prior to onset. So they're still focusing very much on one province of China, even though it is widespread throughout China. And I'm not quite sure why, and I do not understand the science behind this, and I can't think of it. Does anybody out there know why it's only infectious if you come from Hubei province and not from Beijing? I am completely confused. Or from Thailand, etc. It's an example of a screening tool that's extremely specific, so you don't get lots of false positives, but at the same time, to me this strikes me you're going to get false negatives, people who actually have it but don't fall under the screening protocol. So how do you become a probable case in Ontario? Well, you have to have a high-grade fever over 38 degrees Celsius and or new onset or worsening of chronic cough or breathing difficulties. Well, that's assuming a high-grade fever, and all I'm reading is it's low-grade or no fever, but you know what? Who knows? I guess this is best science available. And they've travelled to Hubei province, Wuhan, in the last 14 days before they got sick. Just Wuhan, nowhere else. or they've been close to, and their definition of close contact is very, very close, with a confirmed or probable case, and or close contact with a person who's been sick with a respiratory illness from Hubei province, Wuhan, China, within the 14 days prior to the illness. And of course they then are only a probable case, despite all of the clinical evidence and all the rest of it, if the timing is not able to be done for laboratory diagnosis. So whilst they're waiting for laboratory diagnosis, they will be probable, not confirmed. Now, laboratory diagnosis was around 24 hours minimum to get it done, so I'm not altogether sure if that's still the case, and I'll probably find out when I go to work tonight. So it's just a bit of an update from February 5th. This is a Ministry of Transport form. After SARS in 2003, Ontario decided that every movement of every patient from a hospital to a facility or a facility to a hospital would be paper tracked and electronically tracked, and they used the Ministry of Transport forms. And these have evolved over time. Basically it captures a whole bunch of information, so it goes into a database. It's also partially a screening tool. Now this is the new one that came out, which has now been changed. So as you can see from this one, and I'll explain that now as a talking head. So that doesn't really capture it. I understand, and I already mentioned that, false positive. We have like pretty much everybody being screened and failing the screening and then having to be tested or treated differently on transport. It would grind everything to a halt, which would affect patient care, wait times and the economy. However, I do think it's prudent at this point to actually screen automatically anybody who's been in mainland China in the last 14 days. Makes sense to me. But that's not what we're doing, and it got worse. Now I have to be careful with this because I don't want to actually show you patient details, but what I noticed last night at work when I was processing one of these forms for the actual cardiac unit, so you can actually see this, they've altered that criteria. Now that criteria is fairly in depth, so they've altered it to this. Yes folks, February 5th, Ontario Health believes that unless that person has been in Hubei province in the last 14 days or has been in close contact with somebody in Hubei province in the last 14 days, they're not an infection risk. And that's absolutely mind-blowing to me. That is completely different from how we looked at SARS, and SARS is obviously not as infectious as this. That's why we have many more cases of people with Wuhan flu. So it's absolutely astounding. I'm not sure why people from Beijing can come to the hospital with obvious respiratory pneumonia. Okay? Be screened by our normal methods and then sent home without being tracked or in quarantine because they were nowhere near Hubei province in the last 14 days, but they flew out of Beijing 4 days before. Obviously, if it's highly infectious, it's already in the community, and what we're doing is trying to track little cases down. What the World Health Organization is claiming, by claiming this is not a pandemic but an epidemic, is that there's a huge infection source in Hubei province that has cluster outbreaks elsewhere around the world, and that by doing normal public health methods, those cluster cases can be isolated and stopped. We shall see. Now I did bring Becky down here to keep her quiet because the howling is getting to me. But you know, a country's done this before with coronavirus flu, the new one. That country was China, the province was Hubei, the city was Wuhan City. For about 3 to maybe 7 weeks they treated this exactly as the World Health Organization and the Ministry of Health of Ontario were treating it. It's a discrete cluster of people in a discrete geographical area. We just treat them like we normally do with public health follow-up, and it will all go away. And there won't be any spread because it's not infectious unless they're infectious, and it's not easily transmittable. That's what Wuhan City did through December and partially in January. My concern is that this will not weaken, that it will stay exactly the same strength. We're not asking for this infection to increase in strength, and that we'll start to see Wuhan-like outbreaks throughout initially China, Hong Kong, possibly Tokyo, Japan, because they have a cluster of cases already because of the cruise ship, and also a lot of people from Japan are already in Japan who have had Wuhan flu or been exposed to it. So I see this as plateauing for 3 or 4 weeks and then boosting up. Now I did say you should voluntarily quarantine yourself as far as you can for this week and last week, and I do think this now being Wednesday, I do think there'll be fair clarity by Sunday on if we're going to see a big spike in cases externally to China. Initially, the spike in cases will be areas that are geographically close to China. Right now, it seems to me that we're not getting much in terms of obviously people infected. Certainly my hospital has no current cases and no current suspects. There have been a few while I was off, but I noticed with interest that they never made the press and they didn't get into the figures. But that is of course because the figures will give you the impression that this is under control, public health knows what it's doing, there's no need to wear a mask, stop panicking. The whole focus is to keep control of the population, the whole focus is a PR job. In fact, the focus should be to scream out loud, wash your goddamn hands, start to take precautions, cut down unnecessary travel and social activities for the next 2 to 4 weeks. We have flu, it's in our community, it can spread, we don't know what's going to happen with it, but it's prudent to be careful. Okay? It's prudent to be careful. There's no reason at all why an actual release of the actual thought process and information to both nursing staff, which has been controlled as well, at my hospital at least, and to the general public can't be done in such a way that doesn't cause people to commit suicide and leap off buildings screaming in fear. What you've now got is a large number of people who no longer feel that the official government response is adequate or truthful, and I don't know if that's altogether fair, but the bottom line is they're buying N95, N100, P100, P95, face masks, whatever they can buy online, and paying 2 to 4 times the price of it right now.
Alrighty, so begins the price gouging. Of course, it's probably been going on for a little bit longer than my video will post. The prices are too high. Look at this. New, 4 from $40. These people that were selling them for $16, and one said not $12, I think, now want $40, $59, $65, $68, $70, and $120. You know what? I don't know. I kind of feel like there's a special place in hell reserved for people who do this sort of thing.
And they're doing that because they're scared. And there's no need to be scared of the flu. It'll come, it'll peak, and it'll go away. A flu like this one is going to kill more people if it spreads as widely as normal flu. Maybe 10 times more, maybe 20 times more. If you're one of the people that dies, it's tough for you. But it's not going to destroy the planet. Well, we're doing that. But it's not going to destroy the planet this week, next, or in 2 or 3 months. This is not an apocalypse. What this is, though, is definitely an SHTF. It is definitely hitting the fan. It definitely is. And my concern when I go online is I see a lot of preppers who fall into the 2 extremes. It is the apocalypse and we're going to have armed insurrection on the streets and you better get your guns out and start shooting people when they come for your rice, which you probably don't know how to cook anyway, probably aren't able to cook it. And the other extreme is like, yeah, it's nothing. More people die from the flu every year. They do. And then certainly if Wuhan flu gets the penetration into a populations that normal flu gets, and there's no particular reason I can see that it won't, it'll kill a lot more than normal flu. Maybe at that point you're going to sit up and take notice. You really do need to take a grip on actual threats. This is an actual threat that has become real. And as much as I don't want to go through SARS that I went through in 2003, as much as Kitty doesn't want to go through it again, it was ghastly for us. We both nursed a lot of SARS patients in 2 ICUs in Toronto. It was horrible. We were in voluntary quarantine for months. Months. Something like Wuhan flu is a lot more infectious than SARS. You lot might have to go into voluntary quarantine for months and months and months. Whether the government orders it or not, whether they drag you off to a FEMA camp or not. And let's face it, if you're breaking quarantine and you're at risk to the community, I hope they do drag you off, break in your house and drag you out. Because it's going to be a definite effect that's going to absolutely freak people out. And you don't need to be freaked out by this. If you get it, you probably won't have to go to hospital. If you go to hospital, it'll probably be a mess. Take people with you to nurse you. And if you die, you die. We all die. Get over yourselves. This has not got a huge death rate. 2 to 3% of hospitalized cases seem to be dying. That is trivial. The 2 to 3 people in 100 who die, it's awful. For everybody else, it's not bad at all. Now I just want to finish up with a non-research, non-referenced opinion piece. I work with nurses because I work in a hospital, and some of those nurses come from China, and some of those nurses come from Wuhan City, and some of those nurses from Wuhan City have close family in Wuhan City. What they're telling me is pretty much what the mainstream Chinese government is showing, except the only difference is people aren't dropping dead on the street, they're not burning bodies in the corners. There's a significant problem, there's a lot of people dead, people are avoiding the hospitals like the plague. A lot of people have been confirmed sick, but aren't that bad. But a few people, and this is concerning me, young people, have had it really bad and have died. In one particular case, they drove a long way to try and get help, probably in Hong Kong. So they're actually fleeing out of the area. If you're very sick, you don't feel trust in the government response in Wuhan City. For obvious reasons, they're absolutely stuffed and overwhelmed. They can build as many hospitals as they like, but at some point you just can't keep flying in military doctors and nurses because they're needed in their hometowns. So that's the concern. While it remains localized, it is an epidemic, but this is also a pandemic in the making. And I think World Health Organization needs to go to the extra mile tomorrow or today and declare it a global pandemic. It gives people a lot more focus in getting ready for multiple casualties. My hospital's ready for 1. We could maybe manage 2 to 3 properly. We could probably stretch to 12 to 15 properly, but boy, it would be a real disruption. We go above 20 cases without discharges, because our hospital's full all the time, we're not going to cope very well. And I think that's the message. We're also going to see a lot of staff not show up for work. Much more so than in SARS in 2003. People aren't ready for this. The young nurses that I work with who've never been through anything like this are absolutely terrified. Now the hospital has started to do a better job of communicating honestly and openly with staff and put people boots on the ground on the floors to show people how to put PPE on and off and talk to them about risk factors, talk to them about if they're pregnant, risks and stuff like that. So that sort of knowledge to the front line is absolutely vital. So again, when you get knowledge on this from online sources, be a little skeptical. Don't get too bound up into the military takeover of China aspect and the erosion of rights. You will have no rights in a pandemic. You will have no right to endanger anybody else in the community. Your rights will be suspended and they will be enforced military if required. Most people won't require that. Most people aren't stupid and they get it. Mixing around with people, not wearing face masks, stuff like that in a pandemic is tantamount to saying, I don't care about you. In a pandemic you no longer have the autonomy right to do that. And I will do one on likely medical impacts. I'm kind of waiting to see where it's going before I go into it. I mean, obviously medical impact's going to be minor to major to catastrophic. In Wuhan City it's catastrophic. In my hospital it's minor right now. I'm in Canada. So I just want to talk about access to health, what's going to be likely the effects and stuff like that based upon what I know from SARS, what I know from my reading of the provincial health plan, and what I know from having to enforce the provincial health plan in my hospital, because I'm the person that would actually enforce it, and what I see is going on. So that's it for me and Becky, who's now wandering around. Take it easy, don't get scared, don't panic by expensive masks, keep calm and carry on. It is just flu. It's a nasty, nasty flu. It's a flu that people will talk about for a long time. But unless it actually breaks out in your city on a large scale, it is pretty well not the end of the world. And if it does break out in your city on a large scale, it's going to have a really massive effect on your everyday life, whether you want it to or not. Doodles. This has been Bad Terry Production 2020.